Damage to the shock-absorbing cartilage around the edge of the socket, which is essentially the labrum, is a commonly missed problem on many fronts. It's difficult in terms of how patients describe it. It's difficult for doctors to pick up. The imaging may not pick it up, and then the treatment is actually quite complex. So this condition of femoroacetabular impingement is a very specialized area. It's essentially an abnormal contact between the thigh bone and the edge of the socket, such that the shock-absorbing cartilage around the edge of the socket becomes damaged. This is the labrum and essentially becomes a labral tear. If that damage continues, then the articular cartilage inside the joint then gets damaged as well. And this condition is femoroacetabular impingement, and if left untreated, will lead to hip arthritis. Is treated, having made the diagnosis, firstly with a conservative course of physiotherapy by a hip specialist physiotherapist. We usually add in an injection of steroid into the joint to calm the joint down, and this gives us a window to build strength and control both of the hip and the pelvis. For those patients that are then unable to get that control back or unable to return to their sporting activity, well, they will then decide that they want to go down the route of hip arthroscopic surgery. So this is keyhole surgery to treat the labral tear, any articular cartilage damage in the joint, and get rid of the extra bone that may have formed, which actually causes the damage as well. A prolonged course of physiotherapy is required afterwards, and then patients can get back to their sporting activities.